Good afternoon. This is Erin with the Department of Medicaid. It is not quite 2 o'clock and we're still clearing the waiting room, so we'll give it just a few moments before we get started. It is now 2 o'clock. I see Keith, Linda, and Troy logged in. Did I miss any other TAC members?
Thank you, Brian.
I'm sorry, Keith.
That wasn't me, but
Oh,
no worries. I did just get a message from Jacob Carroll. He's got an emergency he's tending to and will not be able to be on the call.
okay. If you'd like, we could give it just a moment longer to see if anyone else joins us, or if you want to go ahead and get started, I'll leave that up to you.
Do we have enough on now to start to have a quorum, or do we need one more?
We do not have a quorum as of right now.
Yeah, let's see if we give it another minute or two. I'm unable to see everybody that's on the call. Troy, do you know if Dana has been able to jump on from A and B?
I haven't heard from her, but I'm texting her right now.
Okay, thank you.
I think she's joining now, Keith.
Very good. Once she gets on, that should give us quorum, I believe.
I think AMB meeting is her. I think she
Yeah.
logs in that way sometimes.
Yeah,
Okay.
that's her. That's her.
Okay.
All
Yeah,
right.
I would give her just a second to get logged in so she can hear us. It looks like she's connecting now.
Very good.
Okay, there we are. Sorry, y'all. My Zoom decided it wanted to update right when I was trying to get on.
That's all good. It happens a lot. Teams isn't much better either, so.
I had the same issue, Dana, and then some of my buttons moved after the update. So, okay. You do have a quorum now, Keith, and your waiting room is clear.
Okay, very good. Since we've got everybody online, let's go ahead and get rolling. We've established quorum. First thing we need to do is approve minutes from the July meeting. I know it's been some time since we've had a meeting, but the minutes came out back in July. Hopefully, everybody's had a chance to review those. And if so, can I entertain a motion to approve minutes from the July meeting?
Motion to approve?
Got a motion? Do we have a second?
Second.
Okay, we got a motion and a second, and I believe we need to have everybody on screen that's voting. So, Steve, if you and Linda can also pop on your cameras for the vote. Right. We got Steve. All right. Okay, all those in favor, please signify by saying aye.
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 Any opposed? Any abstentions? Very good. Motion passes. Minutes are approved. All right, going into old business, one of the things that we wanted to check on, when I say we, am meaning the EMS TAC, is we know that the process we all went through last year to get the process changed from the pre-authorizations over to the PCR or PCR submission was a huge ask and was a very big lift for all of our MCOs. So we wanted to reach out to all of our MCOs to see if you all have had any issues with EMS providers. Is there anything that is not currently working to the point that we need to look at tweaking the system or whatever the case is? So if you are an MCO and you have something you would like to bring up about the PCR submissions, please feel free to speak up and let us know so we can take it back to our counterparts on the EMS world. All right. Not hearing anyone, I'm assuming then things are going well. With that in mind, I wanted to also do a quick update on the current status of payments. Do we have any issues from our billing companies or EMS TAC members with payment or reimbursement payments since we switched to the PCR system?
We have had a few issues. It started off with, I believe it was Aetna that didn't accept electronic attachments. We've been able to work through most of those, but I will say we've had a few, just a few bumps and things go on. But I believe we have, at this point, we don't currently have any issues. I think everything has been straightened out and those claims are being accepted with the electronic submissions now, so.
Very good. Glad to hear that. We did have an issue earlier on at the beginning of this process with an activation date issue, but the folks at DMS were able to work with the MCO that this pertains to, and they were able to get that straightened out. So it's good to see that a change this profound has gone off as well as it has, considering the number of people that it affects and the positive outcomes that this PCS forum has allowed our EMS providers to be able to have. So thank you everybody for as smooth of a transition as we could ask for in going to the PCR process.
Keith,
So, yes.
we have been having a little bit of problem with WellCare first to 9 saying prior authorizations required and having to refile the claim with the PCS form. Once we do that, then they are paying it, but they're not paying it initially. And that's just WellCare.
Okay, now
Hey.
is that, go ahead.
Sorry, I was gonna say, hi, Linda, this is Stuart with WellCare. Stuart Owen, I'll put my email in the chat. If you send me examples, that'd be great.
Okay. All right. Thank you, Stuart.
Sure.
Very good. Thank you for bringing that up, Linda. Thank you, Stuart, for making yourself available for Linda. Honestly, this is one of the great things about having these TAC meetings is being able to get our EMS providers and billing companies to have open, honest communications with the MCO so we can take care of this for our EMS providers. So thank you very much. Okay, jumping over to new business. One of the things that we talked about during the last meeting was the issue we are having with the low reimbursement rate, especially for the non-emergency transport side of Medicaid. Neither side, quite honestly, both the emergency or non-emergency pays great, but the non-emergency side being a $55 reimbursement with a $2 per mile loaded mile fee, we can't, it's just unsustainable. We've been working towards coming up with something different. We know that this is a non-funding year for the legislature. However, we understand that DMS did have a 25 million in expansion funds that was given for this year that we could potentially qualify for. Obviously, a study would need to be done to determine what a fair compensable rate could be. And actually, this is where I would like to open it up to anyone at DMS that can explain what process this study would need to look like and what data we would need to collect in order to help expedite a review so that we can look at potentially increasing the Medicaid rate for our EMS providers. Do we have anybody from the comptroller's office or somebody at DMS that can answer that?
Hi, this is Amy Richardson. I'm the Director of Fiscal Management here in Medicaid. So there is language in the biennial budget for state fiscal year 25 and 26 where a study will be completed and Medicaid reimbursement rates will be increased based on the study. So the department is not responsible for completing that study, and we haven't been asked to provide any information related to that study. It's my understanding that LRC has hired a couple of individuals that are going to be conducting the study, for provider reimbursement rates, and they are going to determine how the money in the budget should be distributed out amongst all of the providers.
Okay, do we know, well, obviously you said LRC is hiring, so you probably won't know who that is until they get hired. Do we know any more details about this as to if they are going to reach out to the individual groups that get reimbursed by Medicaid to see basically what exists now, the ramifications, or what we would like to see, or do we know anything about the process at all that they're going to go through?
Well, I can say I have not heard. I'm not sure if some of the cabinet folks that are in OLRA, the legislative area of CHFS, have heard any information on how this is going to get conducted. But as far as like Medicaid, we have not heard, they have not provided us any details on how the process is going to work.
Okay.
I apologize for not having more information, regarding this, but we're kind of we're in the dark as well.
No, I understand. Just with the legislative session coming up very quickly, it would be nice if LRC or whomever could let us know what needs to be reviewed so that we could potentially be working in the background to get that information to provide to them to hopefully help make their decision a little bit more timely and more educated so that they can see what we're dealing with on the reimbursement side. Because again, the HBA program helps some on the emergent transport side for EMS, but doesn't touch the non-emergent side. And a $55 reimbursement at today's day and age doesn't even cover salary of one of our providers for an hour. So we are grotesquely losing revenue on every Medicaid transport that we conduct in EMS. So it's imperative that we try to facilitate any way we can to get this amount up. And with that, one of the questions again I had is, actually the TAC has is it possible for us to request the Medicaid statistics for either calendar year 23 or FY 24 that shows the number of emergent transports that have been billed through Medicaid for that particular year, or along with the number of non-emergency transports that have been billed through Medicaid, so that we can at least get that information established and agreed to upfront, so that whoever does this study, that's a little bit of information we got ahead of us, and we can start working with our billing companies to be able to find out how much the individual services receive, so that we can hopefully come up with an honest to God fact-finding ledger, if you will, of just, this is gonna sound bad, but just how awful the $55 is doing to reimburse our crews. And with that, I'd also like to open it up to the other TAC members. If you'd like to jump on or clarify anything I'm saying, please feel free to do so.
Keith, I can provide you, of course, we can release that information. Of course, it would be redacted, you know, with the Medicaid members PHI, but we can provide, you know, the overall trips and reimbursement. I can email you the how to submit an open records request for that information. Yes.
I was just gonna say typically the tax will make the data request and then I take care of it from there.
Okay, so he doesn't need to do an open records. Okay.
No, ma'am.
So you could email Erin Vickers and let her know exactly what you want to see, and she could complete that data request for you. But Keith, I also know that Mr. Duke has asked that we start adding you to our APAP program biweekly meetings. And so Jim Duke may have that information readily available, because I'm sure that we have provided that for him for the APAP program for the last few years.
Okay.
So, but we're happy, you know, if you want to email Erin, we're happy to provide the information that you need.
Okay, thank you. Are there any other of the TAC members that have additional information you think that we need to ask for at this time? What's your all's thoughts?
Not necessarily for Medicaid, because I know last year and the year before, we'd kind of done a survey for cost per run from our agencies, which is, I think, super important to show, you know, what we spend per run. So I don't know of anything else from Medicaid side.
And another recommendation I may add is you could potentially contact your legislator and, you know, see if they have any information on how the 25 million is going to be distributed amongst Medicaid providers. They may have, you know, a contact information in-house for someone that you can reach out to and possibly become involved in that process.
Okay, very good. Yeah, I'll be happy to do that.
Keith,
Yes.
one thing to be aware of, to be sure, which I'm not saying they're not losing, they definitely are, but the MCOs are paying the non-emergent runs. It's only the enhanced fee. It's only the fee for service that is not paying any additional on the non-emergent. Fee for service doesn't pay anything additional on non-emergency.
Right.
MCOs do make a contribution towards it, if my understanding is correct.
What does that mean, by the way, where you say, and like, they don't pay any additional on the fee for service? Can you clarify that?
On the ambulance provider enhanced payments that they pay their tax, their assessment to put money in towards, the MCOs are making additional payment on the non-emergent runs. It is only the fee for service runs that are not getting anything extra, if my understanding is correct.
Okay,
This is Stuart with WellCare. I think that's the federal arrangement through managed care. There's the higher upper payment limit, and that's how CMS approved it. And I think the money is routed from DMS to the MCOs, then on to the ambulance providers. I think that's how it's set up and was approved by CMS.
Yes.
Okay, I'm trying to process all this in my head here of how how that actually works. Because I know we've got, well, let me back up. I believe we have a distinction between also government operated services and private services also makes a difference. And that's something that I think Linda or Dana, you can probably talk to a heck of a lot better than I can on how that works.
Keith, my understanding of that is that that applies to the APAP money, not to the enhanced payments that we're paying assessment on.
Okay, so to be clear, we've got the HBA program, which is the assessment program,
Mm-hmm.
and we've got the APAP program that, are we talking about the existing APAP or the proposed APAP?
I didn't know we had an
Our
APAP
proposed.
program.
Yes.
Program.
So the department currently has an APAP program, where ambulance providers receive a monthly payment from the MCOs. And, that's like I hate to say supplemental because CMS doesn't like us to use that word, but that is a directed payment from DMS to the MCOs, and the MCOs pay that out to the ambulance provider. So that's an add-on payment for your runs. And in turn, the ambulance providers pay a provider tax. So I'm not sure if the provider tax is what you're referring to as the assessment. But
Yeah,
you
that's
know,
what I'm referring to.
okay, so DMS calculates, based on historical utilization, an add-on dollar amount to each trip. And that money is distributed from DMS to the MCOs to the providers on a monthly basis. And then on a monthly basis, the providers in turn turn around and pay a provider tax to the Department of Revenue.
Right, right.
So
So
that's the current APAP program.
Okay. I don't think the initials on that are APAP, are they, Keith?
No, I think gosh, Troy, you may have to correct me on this, because I wasn't too involved with the HPA process.
The APAP is the new proposed stuff for the city, county,
Yes.
municipal stuff. That's the
Okay, no, we're talking about the same programs, but I want to make sure we got our acronyms right. So APAP is the current program that we are administering every single month. We have that approved through CMS. We have an annual renewal on that. That's the APAP program that you all receive the money and then you're paying the provider tax on. What I think you're referring to as the new program is called the ASPP program. And the ASPP program is something that we had worked on, I lose track of time, maybe in 2019, 2020. And that was going to be earmarked for the providers that are owned by local governments. So your city governments, your county governments. That program was going to be called ASPP. And that program never got up and running because of some feedback we received from CMS, which is the approval authority that we have to go through to get programs like that approved.
Okay, yeah, you're right. Okay. Yes.
I just want to make sure we're all speaking the same language.
But I
Thank you
think
for
that's
doing that.
trying to come back again. I think they're fixed to go for round 2 for that.
Yes, and we've had some email traffic between, our the Medicaid CFO, Steve Bechtel, in our commissioner's office, and we've kind of revisited like the reason CMS told us no versus what the providers wanted. And basically the issue was that it had a lot to do with like the random moment time study. So how we were going to allocate the expenses and things like that. So, you know, we can revisit that. You know, I can't remember if the commissioner was going to get a call scheduled or something like that. But yes, ASPP has came back up over the last few months, and DMS has worked on some talking points on why the program was never moved forward back in, I think it was like 2020.
It is confusing when you've got an APAP and an ASPP. It's getting a little close to
Yes.
another on acronyms there, so I could see why that is confusing.
But for our discussion though, the possible reimbursement, the study and stuff of that is for the base Medicare reimbursement rates and has nothing to do with those, correct?
Yes, base Medicaid rate. Yeah,
Okay. That's what we're working on. Okay,
yeah, that's correct. At least that's what we want to be working on.
correct.
Okay. So I will go ahead and, Aaron, do you need me to draft an email to you requesting the specific information to make it legal, or do we need to attach minutes to the meeting where we've asked for it?
I have your original email request, so unless there's a specific way you'd like the data broken down, I should be able to. And I did want to verify that was for calendar year 2023 or fiscal year 2024.
Yes, whichever gives us a full year's worth of data that can be used.
I would assume that would be calendar year 2023, but I'll defer to my data people.
Okay. Just knowing how everybody has different, most people have different budget cycles for their fiscal year is the only reason I wanted to be able to clarify one being either the calendar year or one being the fiscal year, whichever is closest to being complete data. All right, any other questions about that from TAC members or MCOs? All right, item B under new business, we did get the dates for the 2025 EMS TAC meetings. They are as stated there, January 27th, April 28th, July 28th, and October 27th. If you remember, we agreed this calendar year that we would go to quarterly meetings instead of doing bi-monthly meetings. So so long as everybody's still good with that, then those will be the meeting dates that we will use going forward. All right, item C, this was just a very quick add-on for today because the email we received today was unexpected about an Anthem Medicaid transition. Is this anything anybody at DMS can talk about yet as to how it could or may affect EMS reimbursements, or is this still new enough to where attorneys are still trying to figure out how it will be handled? And to the folks that may not know what I'm talking about, there was a message that came out this morning about Anthem transitioning away from Kentucky Medicaid, I believe at the start of 25. It was a message that came out earlier. So I didn't know whether or not any of the TAC members may have questions regarding this, or any of the billing companies may have issues regarding this. And timing was kind of perfect in the fact that we found out about today with our TAC meeting being today.
So Keith, this is Amy Richardson again, and you know, I can give, you know, just a high level summary, which is probably what was in the notice you received. Over the next 2 months, we're going to work on transitioning the Anthem members. So um, I was trying to read the announcement. So members will be reassigned to another managed care organization. So the first thing that we're going to look at is, does any other member in that family already have a different MCO? So let's say mom has Anthem, but the children have WellCare. If there's already someone in that household, they're going to be transitioned to the same plan the other members in their household are. If there's no other members in the household, they're going to be, just transferred randomly, to another MCO. So, Anthem will be required, to pay claims and process claims, through December 31st, and then the claims run out period, after that. So we expect, to have an ongoing relationship with Anthem for, probably the next couple of years, to be honest, based on how our cost settlements work and things of that nature. So, I think any ambulance provider that transports an Anthem member between now and December 31st, it's going to be business as usual. And, you're still going to bill those claims to Anthem, et cetera. And then after January 1st, you're just going to see some movements in our members. They're just going to be assigned to different MCOs.
Okay, thank you for that explanation. Just one question that comes to mind on this, because it typically happens at the first of the year when
Mhm.
people have gone and changed insurance companies through their open enrollment. If, let's say, we transport a patient, let's say March or April of next year, the patient doesn't have their new card, and they still give us the Anthem card, and we file it for Anthem, it gets denied and comes back, and then we have to go through the process of getting the correct information for the patient. Will we run the chance of a timely issue coming into play where we wouldn't get reimbursed because the member wasn't able to give us an updated card on what insurance they're covered under?
I don't foresee that being an issue. Honestly, we have, I think it's a 1-year timely filing. So as long as you file the claim, within a year of providing that service, I don't see that being an issue. We are hoping that the members have a new card in hand by January 1st.
Okay.
So, I think those might just be one-off type cases that we, have to deal with on an individual basis. But I don't see any reason on why you all won't be reimbursed appropriately.
Okay, great, thank you.
And I'm not sure, Aaron may have already shared this information with you, but we have set up a website related to the Anthem transition, and it's going to have, provider communications, member communications, and also our FAQs that are, they're going to be updated, as questions come up. So we can make sure we get that web address to you all, so you can stay informed on any of the latest developments.
All right, very good, thank you.
Thank you.
All right, very good. Any other questions or comments from TAC members on any of the new business we discussed? Okay, hearing none, we'll drop down to general discussion. Do we have any topics that need to be discussed amongst the TAC members or the MCOs regarding EMS? All right, we are flat blowing through it today. All right, going down next to the MAC meeting representation, I'm assuming, or I'm sorry, the recommendations. I'm assuming we have no recommendations to make to the MAC regarding what our status is at this point in time. Is the rest of the TAC good with that assumption? You just give me a thumbs up if you want to, so we don't have to go through the voting process. All right. All right, dropping down to item number 8, MAC meeting representation. The MAC meeting, that occurred last month, went about three hours or so. I did have the opportunity to brief the MAC, on where we are with the, PCR forms. And also the request that we had coming forward, to review our, reimbursement status, especially for the, Medicaid, non-emergency and emergency transports. The MAC was, happy with the information that we provided. I can tell you that from the MAC, there is a general consensus, amongst all of the Medicaid providers that they would like their areas to be reviewed as well for the reimbursement. So I got a feeling that, Amy and company are going to, be seeing a lot of, information coming across to them from providers, whether it's dentistry, behavioral health, long-term care, doesn't matter who it is, everybody's asking for increases in their, Medicaid reimbursement. So it's probably going to be a contested fund where everybody's going to want to get a piece of the pie when it becomes available. So just heads up on that. All right, our next meeting will be, January 27th from 2 to 4. And with that, I'll open it up one more time. Does anybody else from the TAC have any questions, comments, or the MCOs have any questions or comments? All right, let's move to adjournment. We just need a motion to adjourn.
So moved.
Motion from Troy. Do we have a second?
I'll second. It's
Second. from
Linda.
Mike. Very good. We got a motion and a second. All those in favor, please signify by saying aye.
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 Any opposed? Any abstentions? Very good. We stand adjourned. Thank you all very much.
Thank you, everybody. Have a great afternoon.
You too, Aaron.